any proof anywhere or substantive idea when you take things like fish oil, B vitamins, vitamin E, that there is any proven value whatsoever to brain health?
At this point, very little, unfortunately. We have a variety of supplements. Some of the ones that you mentioned, ginkgo biloba was sort of one of the big things when I was first in medical school, and even then it was starting to come a little bit out of favor. Things which seem to be associated with better function on dementia. And you'll find lots of little studies, and part of the problem is the company that's selling the product is naturally going to want to sell you on studies that seem to show that
they are, at the end of the day, salespeople.
Absolutely, and that's a problem. And you get less of it for things like vitamin E because people are not making too many dollars on vitamin E, typically. But you get another supplement, I'm not sure if I should be mentioning names here, but for instance, I go on a particular site and I look for their evidence, and they have one trial which is based out of Madison where it doesn't even look like it was published. And it does seem to show some trend, and if you're looking at it in a fairly relaxed style, oh, they did much better, but you know, when you have someone who actually understands the statistics of this and how these trials are designed, you start seeing that yes, there was some improvement here, but there was not improvement here. They don't go into that type of discussion. And in science, what we really need to do is reproduce data. So we need to have a study which shows that there is an effect. Somebody else somewhere else will do the same study or pretty similar to it and get a similar effect. And when you have enough of these together, you get some ideas that that really is the proof. So a lot of these supplements have one or two things that seem to show help, but other studies that don't. And if you put it all together, there's not a very convincing argument that supplements work.